This is a CMA Clinical Competency Practice Test. This test consists of 50 questions designed to help you prepare for your clinical competency section of the Medical Assistant Certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. Sterilization means that A. All organisms have been removed from an object. B. All pathogenic organisms have been removed from an object. C. Debris has been removed from an object with soap and water. D. The object has been placed in boiling water. E. The object has been subjected to ultrasonic cleaning. Correct answer: A. All organisms have been removed from an object. Sterilization means that all organisms have been removed from an object by either gas or chemical sterilization or by autoclave. Disinfection is removal of all pathogens. B. Removal of debris with soap and water is called sanitization. C. Boiling, D, does not sterilize, and ultrasonic cleaning, E, is a method of sanitization for delicate instruments. 2. Using a tape measure to evaluate the head and chest circumference of an infant is called A. Auscultation. B. Mensuration. C. Palpation. D. Percussion. E. Observation. Correct answer: B. Mensuration. Mensuration is the process of measuring something. Auscultation, A, involves listening, as in evaluation of the bowel sounds using a stethoscope. Palpation, C, and percussion, D, both use touch. Palpation would be using the hands to feel the temperature of the skin, and percussion is tapping in order to hear different sounds. Observation, E, is visually evaluating the patient. 3. What is the maximum time allotted for a collected blood sample to sit in a serum separator tube before being centrifuged? A. 1 minute. B. 5 minutes. C. 15 minutes. D. 30 minutes. E. 60 minutes. Correct answer: D. 30 minutes. The tubes with red/gray, tiger, stoppers and gold Hemiguard stoppers contain a clot activator and separation gel. They are commonly called serum separator tubes, SSTs. After inverting the tube 5 times, the clot activator shortens the time required for the formation of a clot. The separation gel in the bottom of the tube changes viscosity and will migrate up and form a barrier between the serum and blood cells. 1 minute, A, may seem like a familiar number during the routine phlebotomy procedure because of the typical time restraint associated with tourniquet application. 5 minutes, B, is associated with an accelerated clotting time seen with the use of the yellow/gray stopper tubes or orange Hemiguard closure tubes. These tubes contain thrombin, which is activated after the filled tube is inverted 8 times. These tubes are used for stat serum chemistry testing. 15 minutes, C, is the customary time for centrifuging a serum separator tube. 60 minutes, E, is the normal amount of time for a blood sample to clot in a tube that contains no additive. Red stopper tubes are then centrifuged to yield a separated sample of serum from blood cells. 4. A medical assistant is giving a DPT injection to a 6-month-old infant. The assistant would give the injection at which of the following sites? A. Upper outer quadrant of the gluteus muscle. B. Deltoid muscle. C. Vastus lateralis. D. Subcutaneous tissue of the thigh. E. Gluteus medius. Correct answer: C. Vastus lateralis. The vastus lateralis is the preferred site for an infant who is not yet walking. The gluteus muscles are not well developed until the child is walking, A and E. The deltoid, B, is too small and underdeveloped in the infant. The injection is to be given in the muscle, so the subcutaneous route is not acceptable, D. 5. Which of the following actions should the medical assistant take to ensure disposable thermometers are ready for an exam? A. Confirm that they have been autoclaved within 28 days. B. Ensure the expiration dates have not passed. C. Swab the tips with alcohol. D. Place probe covers on them. E. Store them in a locked cabinet. Correct answer: B. Ensure the expiration dates have not passed. Disposable thermometers become inaccurate after their expiration dates. As the thermometers have not been used before, sterilization and probe covers are not required. 6. What information will not be found in the medical record of a patient? A. If the patient admits to any illegal drug use. B. Personal opinion of the medical staff. C. Legal history of the patient. D. Direct quotations from the patient. E. Medication history. Correct answer: B. Personal opinion of the medical staff. Personal opinion of the medical staff is not to be placed in the patient's chart. Only facts are to be documented. Direct quotations from the patient may be included and quotation marks used to specify these quotes. D. Medication history, E, would be documented to give information about past medications that have been used and the effect of those medications. This includes medication allergies. Legal history, C, and patient report of drug use, A, are included, as this information is used to assess risk of disease. 7. If the physician is going to do a pap smear, the medical assistant should have which the following equipment available? A. Curette and dilator. B. Speculum and water-soluble lubricant. C. Suture removal tray. D. Hemicol card. E. Sterile gloves and a light source. Correct answer: B. Speculum and water-soluble lubricant. Have ready a speculum for visualization and a water-soluble lubricant. You would not need to dilate the cervix in order to do the procedure. A suture removal tray would not be needed for a vaginal exam. C. Sterile gloves are not necessary for the routine procedure. E. The hemicol card, D, would only be necessary if the physician is also doing a rectal exam. 8. Emergency treatment for a second-degree burn would include: A. Bandaging tightly. B. Breaking any blisters seen. C. Applying a clean, cool, wet cloth to the area. D. Scrubbing the site with antiseptic soap. E. Applying an emollient cream. Correct answer: C. Applying a clean, cool, wet cloth to the area. The goal of emergency treatment is to stop the burning in the skin. By cooling the area, the heat is dissipated. A cool cloth will also decrease pain. Care needs to be taken to avoid breaking the blisters, B, and to maintain the skin integrity to prevent infection, D. A bandage, if necessary, should be applied loosely, A. The physician may order silver sulfadiazine cream, which has bacteriostatic properties, after the burn has been assessed, E. 9. Evaluation of the spinal column is accomplished easily from which of the following positions? A. Knee chest. B. Prone. C. Supine. D. Lithotomy. E. Trendelenburg. Correct answer: B. Prone. Prone position, which is lying flat on the abdomen, would offer the best access to the spine. Knee chest, A, is used for proctologic exams. Supine, C, is lying flat on the back. Lithotomy, D, is used for vaginal exams and pap tests. Trendelenburg, E, is the shock position with the legs positioned higher than the heart. It is used in patients who have a low blood pressure or feel faint. 10. To respect the patient's privacy while obtaining information about their history, you should: A. Ask the patient to fill out a form rather than asking the questions in an interview. B. Ask the patient to specify people who can give information about them. C. Take the patient to a quiet and private area to obtain the history. D. Let the doctor ask any questions that you feel the patient may be sensitive about. E. Explain that if the patient does not want to answer any of the questions, it is not required. Correct answer, C. Take the patient to a quiet and private area to obtain the history. By providing a quiet and private area, the patient will feel comfortable sharing information with the medical assistant. Questions should be asked in person so that answers can be clarified. A. The patient history should come directly from the patient, not from other people. B. If a form is given to the patient to fill out, it should be followed up with a personal review of the information. You should not pressure the patient to answer any questions that they do not want to, but can reassure them that their answers will be confidential. E. The physician may have additional questions to ask the patient, but you should not leave history items for the physician to address unless the patient requests this. D. 11. Which of the following terms is defined as the concentration at which a substance in the blood, not normally excreted by the kidney, begins to appear in the urine? Supernatant. B. Refractive index. C. Renal threshold. D. Micturition. E. Aliquot. Correct answer, C. Renal threshold. When circulating substances such as glucose rise to an unhealthy level, the body will attempt to expel the excess via the kidneys. The renal threshold of glucose is 160 to 180 mg/dl. Glucose found in the urine can be associated with diabetes mellitus or pancreatic pathology. Supernatant, A, is the clear upper portion of a urine specimen that is poured off before staining the remainder for visualization under the microscope. Refractive index, B, is the method in which specific gravity is measured by the refractometer. The refractometer measures the refraction of light through sediment in the liquid. Micturition, D, is the act of voiding or emptying the bladder. After assessing the volume of a 24-hour timed urine specimen, a well-mixed portion called aliquot, E, is removed for testing. The remainder of the specimen is stored or discarded. 12. The patient is having occult blood in the stool caused by a medication that they are taking. Which of the following medications would you suspect? A. Lisinopril. B. Coumadin. C. Prozac. D. Hydrochlorothiazide. E. Ativan. Correct answer, B. Coumadin. Coumadin is an anticoagulant. It causes thinning of the blood. The blood levels must be monitored to prevent overmedication and abnormal bleeding. Lisinopril, A, is an antihypertensive, Prozac, C, is an antidepressant, hydrochlorothiazide is, D, a diuretic, and Ativan, E, is an anti-anxiety medication. 13. A fomite is A. An animal or insect that can transmit disease. B. A method of removing pathogens used on objects. C. An inanimate object that can harbor pathogens. D. A sexually transmitted disease. E. A method of sanitization used on objects that cannot be scrubbed. Correct answer, C. An inanimate object that can harbor pathogens. A fomite is an object, such as the exam table, blood pressure cuff, or stethoscope, that can harbor pathogens. Disinfection is the method that is used to remove pathogens from the surface of objects. B. A vector is an animal or insect that can transmit disease. A. Ultrasonic sanitization is the method of sanitization that is used on objects that cannot be scrubbed with soap and water. E. 14. To correctly treat an adult with a foreign body airway obstruction, the medical assistant should first A. Open the patient's mouth and attempt to remove any foreign body that can be seen. B. Lower the victim to the floor and start to perform abdominal thrusts. C. With the left hand, check the pulse at the left carotid artery. D. Ask the patient, "Can you speak?" E. Place your hands around the victim from behind, palms against abdomen, and thrust upward. Correct answer, D. Ask the patient, "Can you speak?" You should first look for the universal sign of choking, the placement of hands at the throat. You will ask the patient if they are able to speak and will not intervene if the patient is able to speak or cough. If his airway is obstructed, you should place your hands around the victim from behind and make a fist with the thumb side of the first in the space below the ribcage and above the navel. Quick, upward thrusts are made until the object is removed, e. The patient should not be placed on the floor while they are conscious, b. There is no need to check the pulse prior to trying to remove the airway obstruction while the patient is still conscious, c. Checking for a foreign body in the patient's mouth would be inappropriate at this time, a. 15. The Ishihara test is used to diagnose a. Myopia, b. Hyperopia, c. Presbyopia, d. Color blindness, e. Need for reading glasses. Correct answer, d. Color blindness. The Ishihara test is used to test color blindness. Myopia, a. is nearsightedness. Hyperopia, b. is farsightedness. Presbyopia, c. refers to changes in the vision as the eye ages and brings about the need for reading glasses, e. 16. A non-sterile item is accidentally added to a sterile field being prepared for the suture of a skin laceration. Once the medical assistant discovers this, they should a. report it to the physician, b. remove it at once, c. leave it on the sterile field but cover it with a sterile towel, d. replace the item with a similar sterile one, e. redo the sterile field and re-sterilize any instruments. Correct answer, e. redo the sterile field and re-sterilize any instruments. You must start over again preparing the sterile field. Any instruments that are in the sterile field must be sanitized and re-sterilized before use. Once the non-sterile item is on the sterile field, the field is contaminated and should be redone. 17. The process used to wash and remove tissue from medical instruments is called a. asepsis, b. disinfection, c. sanitization, d. sterilization, e. boiling. Correct answer, c. sanitization. Sanitization is the process of using soap and water scrubbing to remove blood and tissue from medical instruments. Asepsis, a. is the absence of disease. Disinfection, b. is the process of removing pathogens from objects. Sterilization, d. is the absence of all living forms from objects. Boiling, e. is a method of disinfection but it cannot kill spores. 18. Which of the following is the maximum amount of time a tourniquet should remain on the patient's arm during the performance of a routine venipuncture? A. 30 seconds. B. 60 seconds. C. 2 minutes. D. 3 minutes. E. 5 minutes. Correct answer, B. 60 seconds. The 1-minute time limit was set forth by the Clinical and Laboratory Standards Institute, formerly NCCLS. Leaving the tourniquet on longer than 60 seconds may change the hemoconcentration of certain substances due to the passage of plasma into tissues. 30 seconds, a. may be considered a safe amount of time but usually does not allow enough time to complete the venipuncture. The remaining choices exceed a safe and effective time limit to have a tourniquet tied in place. 19. In a large-scale national disaster or disease outbreak, which of the following considerations should be taken into account by a medical practice office? A. Some patients will come to the office for care due to overcrowded emergency rooms. B. The practice may need to administer vaccinations or immunizations to their patients. C. The practice should communicate with local public health officials and participate in a coordinated plan. D. All of the above. E. None of the above. Correct answer, D. All of the above. The correct answer is D. All of the above. During a disaster or disease outbreak, patients may seek care at the medical office. A. The practice may need to administer vaccinations. B. And response may need to be coordinated with public health officials. C. Thus, choice E. None of the above is incorrect. 20. Employment, use of tobacco and alcohol, and exercise habits are listed in which of the following sections of the patient's chart? It. Social history. B. Chief complaint. C. Review of systems. D. Medical history. E. Family history. Correct answer, social history. This information is found in the social history. This section may also include sexual history, drug use, recreational activities, and present family status. The chief complaint, the B, is where you will find the reason for the patient coming to see the doctor this visit. The review of systems, C, is data that is collected as each of the body systems is reviewed and evaluated. Medical history, D, will include the past medical history and immunization history. Family history, E, is the medical status of the patient's family and any genetic or familial illnesses. 21. If your patient is being treated for a severe upper respiratory infection, which of the following medications would you not expect to see ordered? A. Amoxicillin. B. Albuterol. C. Robitussin. D. Hydrochlorothiazide. E. Cipro. Correct answer, D. Hydrochlorothiazide. Hydrochlorothiazide is a diuretic. Cipro, E, and amoxicillin, A, are both antibiotics. Robitussin, C, is an antitussive. Albuterol, B, is a bronchodilator. 22. The microscope condenser is responsible for A. Collecting and concentrating light rays. B. Holding and moving the slide. C. Controlling the amount of light focused on an object. D. Coarse and fine adjustment for object focus. E. Evaporating water from the slide. Correct answer, A. Collecting and concentrating light rays. The condenser is found within the diaphragm of the microscope and is responsible for collecting and concentrating light rays onto the object on the slide. The stage is responsible for holding and moving the slide, B. The iris is responsible for controlling the amount of light focused on the object, C. The coarse and fine adjustments will bring the object into focus, D. Water evaporation, E, is not a function of the microscope. 23. You should suspect that a patient may be having a heart attack if the patient is complaining of A. Blurred or double vision. B. Severe headache. C. Pain in the shoulder or jaw. D. Difficulty understanding spoken words. E. Weakness on one side of the body. Correct answer, C. Pain in the shoulder or jaw. Referred pain from a heart attack can be experienced in the back, shoulder, arms, jaw, and abdomen. Disturbance in vision, A. Headache, B. Difficulty in speaking or understanding spoken words, D. And weakness on one side of the body, E. are all signs of neurological problems. 24. When drawing multiple tubes of blood via venipuncture, what is the correct order of draw based on colored stoppers? A. Lavender, red, green, yellow. B. Red, yellow, lavender, green. C. Green, yellow, lavender, red. D. Gray, yellow, red, blue. E. Yellow, red, lavender, green. Correct answer, A. Yellow, red, lavender, green. The yellow stoppered tube contains sodium polyanethol sulfonate and is used for blood cultures. When a yellow stoppered tube is among the tubes to be used in a blood draw, it is always drawn first, so the other four choices, A, B, C, and D, are incorrect. The purpose of the order of draw is to prevent mixing and potential contamination of additives. 25. Which of the following is a CLIA waived, low complexity, test? A. Microscopic examination of urine. B. Gram stain. C. Blood chemistry. D. Pregnancy test. E. Pap smear. Correct answer, D. Pregnancy test. Waived tests have been approved by the FDA for home use or are simple lab exams and procedures that have insignificant risk of error. Pregnancy tests are low-complexity tests that can be performed in a clinical laboratory or by a patient at home. Microscopic examination of urine (A) is considered a moderate complexity test that requires laboratory equipment such as the centrifuge, microscope, specialized stain, and urine specimen slides. Gram staining (B) is a moderate complexity test. Blood chemistry (C) is a moderate complexity test. Pap smear (E) is considered a high complexity test. 26. Normal respiratory rate for an adult is A. 8 to 12 breaths per minute. B. 8 to 16 breaths per minute. C. 12 to 20 breaths per minute. D. 12 to 26 breaths per minute. E. 20 to 26 breaths per minute. Correct answer, C. 12 to 20 breaths per minute. The normal respiratory rate for an adult is 12 to 20 breaths per minute. 27. After drying and removing packs from the autoclave, the first thing that you should do is A. Place the newly sterilized packs under the older ones in the storage area. B. Discard all outdated packs. C. Check the indicators to confirm they have changed color. D. Mark packs with your initials and the date sterilized. E. Seal in a plastic bag to ensure sterility. Correct answer, C. Check the indicators to confirm they have changed color. The first thing that you should do is confirm that the autoclave process was successful by checking the indicator tape or strips in bags. The packs should be marked before being put in the autoclave. D. Placing the newly sterilized packs under the older ones, A, and discarding outdated packs, B, are things to be done, but not until you are sure that the packs have been sterilized. Once a pack is sterilized, it is sterile for 28 days, as long as it remains intact. Sealing the packs in a plastic bag does not ensure sterility. 28. Which of the following medications would not be ordered for an elderly patient with cardiovascular disease? A. Lanoxin. B. Lasix. C. Potassium chloride. D. Lisinopril. E. Prozac. Correct answer, E. Prozac. Prozac is used to treat depression. Lanoxin A is a cardiotonic medication. Lasix B is a diuretic. Potassium chloride C is frequently prescribed in addition to Lasix, which can deplete the potassium in the body. Lisinopril D is a medication given to control blood pressure. 29. To be prepared for an office emergency, the medical assistant should A. Keep policies for emergencies nearby for reference. B. Ask a more experienced person in the office to handle any emergency. C. Review the office policies and be aware of location of emergency supplies. D. Call 911 immediately. E. Make a list of emergency phone numbers to place close to the telephone. Correct answer, C. Review the office policies and be aware of location of emergency supplies. It is very important for the medical assistant to be prepared for an office emergency by reviewing the office policies about emergencies and making sure that they are familiar with all the available equipment that might be used in an emergency. The medical assistant must do this when they are new to an area and not rely on more experienced staff or emergency services to respond to situations. B. While it is a good idea to make a phone list, and to keep policies in an area where they can be reached easily, A, this does not replace the need to be familiar with policies and emergency equipment. 30. Examples of a bandage include A. Steri strips. B. Telfa. C. Tubular gauze. D. 4x4 gauze. E. Clear foresight. Correct answer, C. Tubular gauze. Tubular gauze is a bandage that is placed over areas that are hard to bandage. Bandages hold dressings in place, maintain even pressure, support, and protect a wound from contamination or further injury. All other examples are dressings. 31. Which one of the following tests is used to determine the best antibiotic to treat a condition? A. Blood agar. B. Culturing. C. Morphology. D. Liquid culture medium. E. Sensitivity. Correct answer, sensitivity. Sensitivity testing involves the use of the disc diffusion method. Commercially prepared discs with known concentrations of various antibiotics are dropped on the surface of a solid culture medium in the Petri plate inoculated with the pathogen. If the pathogen is sensitive to an antibiotic, there is a clear or kill zone without bacterial growth around the disc. Blood agar A is a common additive to Petri dishes serving as a culture medium. Culturing B involves inoculating the specimen on a Petri dish or other growth medium and incubating at favorable temperatures that allow for optimal growth. Morphology C is the study of a microorganism's shape. Liquid culture medium D can be utilized to keep a specimen alive until it reaches the lab or can be processed. 32. A blind weight is done on a patient by A. Not recording the weight in the patient's chart. B. Asking the patient to self-weigh at home and report it when at the office. C. Weighing the patient in the wheelchair and then subtracting the weight of the chair. D. Shielding the readout so the patient is not aware of what the reading is. E. Taking the weight at the appointment. Correct answer, D. Shielding the readout so the patient is not aware of what the reading is. A blind weight is done when you do not want the patient to know exactly what their weight is. This may be done if the patient is anorexic or overly concerned about weight gain during pregnancy so that the patient will not decrease their intake due to an increase in weight according to the scale. It is inappropriate not to record a weight in the chart, A, or to ask a patient to self-weigh at home and not weigh them at the office, B. Patients who are in danger of rapid weight gain due to fluid retention may be asked to weigh themselves at home and report weight gain of more than 2 pounds in one day to prevent complications of their disease. 33. An effective way to handle patient emergencies in a medical practice office is to take which of the following steps in advance? A. Ask very sick patients to go to the hospital emergency room. B. Identify the at-risk situations that are most likely to occur, given the patient population seen in the office, and prepare to provide care for these situations. C. Make sure that a doctor is consistently available. D. Have a first aid kit in the office. E. Post the phone number for poison control. Correct answer, B. Identify the at-risk situations that are most likely to occur, given the patient population seen in the office, and prepare to provide care for these situations. Each practice should evaluate its unique patient population and specialty areas of practice to determine which forms of patient emergencies are most likely to occur during office hours. Directing very sick patients to the emergency room, A, is not always a proper use of ER services. A physician may not always be available in the medical office, C, so this answer is also incorrect. While having a first aid kit, D, is helpful, it may not meet the needs of more critical emergency situations, such as cardiac arrest, that can occur in a medical office. Poison control contact information, E, is also effective only in a certain type of emergency and is not the correct answer. 34. In the event of a large-scale act of bioterrorism, which of the following steps would not be an approach to be used by a medical office practice? A. Coordination and communication with local public health officials. B. Providing vaccines and/or immunizations. C. Knowing the signs and symptoms related to a disease outbreak. D. Sending patients to the emergency room for diagnosis. E. Practicing proper infection control and waste disposal of contaminated material. Correct answer, D. Sending patients to the emergency room for diagnosis. Choice D. Sending patients to the emergency room would not be an approach used by medical practice offices during a large-scale act of bioterrorism, and the practice office should be able to make this diagnosis. A is incorrect, as offices would be in communication with local public health offices in this situation. B is incorrect, as offices should provide vaccines or immunizations, as needed. C is incorrect, as offices should know what signs and symptoms of diseases to look for to properly respond in a bioterrorism attack. E is incorrect, as offices would need to ensure patient and staff safety by proper infection control and hazardous waste disposal during a bioterrorism occurrence. 35. Snellen testing results give information about A. Blood sugar results. B. Visual acuity. C. Ability to hear vibratory sound. D. Blood pressure. E. Colorblindness. Correct answer, B. Visual acuity. The Snellen test is used to screen for visual acuity. The eye chart is read by the patient from a distance of 20 feet and the results are compared to the normal findings of 20/20 vision. A glucose meter would give blood sugar results. A. Ability to hear vibratory sound is called the Renal test. C. Blood pressure, D, would be measured with an inflatable blood pressure cuff. Ability to distinguish color is measured by the Ishihara test. E. 36. Which of the following emergency situations should receive the first priority? A. Bleeding from a laceration of the forearm. B. Occluded airway. C. Open fracture of the femur. D. Mid-sternal chest pain. E. Grand mal seizure. Correct answer, B. Occluded airway. The occluded airway would receive the first priority, as the body is unable to go without available oxygen for more than a few minutes before brain damage will occur. It will always be the priority situation when there is a medical problem. 37. The medical assistant's role in obtaining informed consent is A. Explaining the benefits and risks of the procedure. B. Making sure that the patient understands and has no questions. C. Answering all questions that the patient has about the procedure. D. Witnessing the signature of the patient. E. Explaining alternative treatments to the patient. Correct answer, B. Making sure that the patient understands and has no questions. The medical assistant must make sure that the patient understands the procedure that will be done and has had any questions about the procedure answered before signing the consent. The medical assistant can then have the patient sign the form and witness the signature. D. If the patient has not had the benefits and risks, A, and any alternative treatments available, E, explained or has further questions, C, the medical assistant must refer the patient back to the physician and have the patient sign the consent after this is done. 38. To remove sutures, the medical assistant should have a tray with instruments that should include A. CLIA hemostat. B. Mayo scissors. C. Sen retractor. D. Litor scissors. E. Bandage scissors. Correct answer, D. Litor scissors. Litor scissors are fashioned with a hook to make it easier to pick up the suture and cut it. Bandage scissors, E, are fashioned in order to cut clothing and dressings without cutting skin. Mayo scissors, B, are a type of operating scissors. A Sen retractor, C, is used to hold back tissue in an incision, and a CLIA hemostat, A, is used to clamp and hold tissue. 39. When there is an unidentified clear liquid on the floor of the exam room after a patient has left the room, the medical assistant should A. Go and ask the patient if they are aware of what the liquid is. B. Clean up the spill with a disposable paper towel and place in the regular trash container. C. Put up a wet floor sign and ask a housekeeper to clean up the area. D. Put on exam gloves, clean up with a paper towel, and put it in the biohazard container. E. Put on sterile gloves, clean up the spill with a paper towel, and put it in the biohazard container. Correct answer, D. Put on exam gloves, clean up with a paper towel, and put it in the biohazard container. It is appropriate to put on gloves, clean up the spill with a disposable paper towel, and place the paper towel in the biohazardous waste container, as it is unclear what the spill is. The spill could be a biohazardous bodily fluid. It is not appropriate to ask the patient what the spill is. A. Gloves should be worn, and the paper towel should be placed in the biohazard container, not regular trash. B. As it is unclear what the spill is. It should not be left for someone else to clean up the spill. C. But it would be appropriate to ask a housekeeper to disinfect the area of floor if one is available after the spill is cleaned up. While the medical assistant would want to wear gloves when cleaning up the spill, they need not be sterile gloves. E. 40. A viral infection. A. Cannot be transmitted by droplets. B. Will always resolve in 7 to 10 days. C. Does not respond to antibiotic treatment. D. Causes tuberculosis. E. Can always be prevented by vaccination. Correct answer: C. Does not respond to antibiotic treatment. Antibiotic treatment is not used for viral infections unless there is a secondary bacterial infection. The viral infection can be spread in a number of ways, including droplets. A. It may resolve quickly or can last for the lifetime of the patient. B. Tuberculosis is caused by a bacterial infection. D. While vaccinations are available for some viruses, they are not for all. E. 41. Factors that affect the action of drugs include all except A. Body weight. B. Use of generic medication. C. Sex. D. Age. E. Disease processes. Correct answer: B. Use of generic medication. Generic and brand name medications must have the same active ingredients. Drug doses are calculated based on a body weight of 150 pounds. A. The effect will be increased or decreased if the weight is more or less than 150 pounds. The elderly and the young may be more sensitive to medication than adults are. D. The difference in the fat-to-muscle ratio of body composition between males and females, C, may make a difference in drug action. Disease processes also change the body's dosage needs. E. 42. When checking supplies in the office, the medical assistant notices that the hemostats in the cupboard were autoclaved 28 days ago. The medical assistant would A. Confirm that each package is intact and without damage. B. Count to see if there are enough available for the amount of expected procedures. C. Place the packages back in the autoclave and run the appropriate cycle to re-sterilize. D. Unwrap and repackage items and run through the appropriate autoclave cycle to sterilize. E. Redate the packages for an additional 28 days. Correct answer: D. Unwrap and repackage items and run through the appropriate autoclave cycle to sterilize. Autoclaved items are considered sterile for 28 days. After that time, they must not be used and must be re-sterilized. They must be repackaged in the appropriate manner in order to ensure that the sterilization cycle has been effective. 43. Symptoms of insulin shock include A. Fruity or acetone smell to the breath and a decreased blood sugar reading. B. Tremulousness and an elevated blood sugar reading. C. Diaphoresis and a fruity smell to the breath with an increased blood sugar reading. D. Confusion, tachycardia, and an elevated blood sugar reading. E. Diaphoresis, tremulousness, confusion, and decreased blood sugar reading. Correct answer: diaphoresis, tremulousness, confusion, and decreased blood sugar reading. Insulin shock or low blood sugar is sudden and symptoms include diaphoresis, tremulousness, confusion, hunger, and tachycardia. Hyperglycemia or diabetic coma come on slowly and cause lethargy, thirst, rapid and weak pulse, and a fruity or acetone odor to the breath. 44. Which of the following steps helps ensure smooth operation in the medical office during a patient emergency? A. Adhering to a pre-established plan and protocols for managing the emergency. B. Avoiding setting up appointments for seriously ill patients. C. Arranging for close proximity to the local emergency room. D. Clearing the office out during a patient emergency. E. Having an AED device on hand. Correct answer: A. Adhering to a pre-established plan and protocols for managing the emergency. The correct answer is A. The best way to prepare for a patient emergency is to have an emergency plan and protocol in the office. B is incorrect, as practices regularly treat seriously ill patients. C is incorrect, as many offices are not located near hospital emergency rooms. D is incorrect, as it is not practical to disperse patients in the office during the emergency. E is incorrect, because it is useful only for a narrow range of patient emergency situations, such as cardiac arrest. 45. Prior to administration of a local anesthesia, the medical assistant should: A. Administer a test dose to make sure the patient does not have an allergic reaction. B. Ask the patient what local anesthesia they have had in the past and use the same medication. C. Carefully take an allergy history from the patient prior to the procedure. D. Confirm that the patient has brought someone along to drive them home after the procedure. E. Look in the patient's chart to see if the patient has had a minor surgery procedure done prior. Correct answer: C. Carefully take an allergy history from the patient prior to the procedure. The medical assistant should take a careful allergy history from the patient so that the possibility of an allergic reaction can be minimized. The medical assistant would not administer a test dose, A. While prior procedures, E, and medication used in the past, D, are useful for information, the same medication may not be appropriate for this procedure, B. The patient will not be sedated or put to sleep for a minor procedure, so a person to drive would not be necessary for that reason, D. 46. The knee chest position is used for: A. Proctological exams. B. Vaginal exams. C. Exam of the chest and upper torso. D. Patients who have difficulty breathing. E. For treatment of hypotension. Correct answer: A. Proctological exams. The knee chest position is used for proctologic exams and sigmoidoscopy. The patient is on the exam table on their knees, in a bowing position with the chest down, leaning on their elbows or hands. Vaginal exams are usually performed in the lithotomy position, B. Exams of the chest and the upper torso are best accomplished in the Fowler's position, C. This position is also used for patients who have difficulty breathing, D. Trendelenburg position is used for patients that have hypotension, E. 47. Which of the following positions should the patient be in for a vaginal exam? A. Prone. B. Lithotomy. C. Simses. D. Fowler's. E. Semi-Fowler's. Correct answer: B. Lithotomy. Lithotomy is the standard position for a vaginal exam. Sims position, C, is on the left side and usually used for rectal exams. Prone, A, is lying face down. Both Fowler's, D, and semi-Fowler's, E, position the patient in the sitting position with the head up and are frequently used to aid respiratory effort. 48. The first thing a medical assistant should do when coming across an adult who is not responsive is: A. Give 2 rescue breaths and then start chest compressions. B. Roll the person onto the left side, keeping the neck and body in alignment. C. Check for a carotid pulse on the side closest to the assistant. D. Look into the mouth to see if there is an object obstructing the airway. E. Reposition the airway and check again for spontaneous respirations. Correct answer: C. Check for a carotid pulse on the side closest to the assistant. According to sequence represented by CAB, which stands for circulation, airway, breathing, the first step of cardiopulmonary resuscitation is to check for the pulse. The carotid pulse is the most commonly accessed in emergency situations. In the event the patient has a pulse but no respiration, a blocked airway is possible, and repositioning the head may open the airway and allow the patient to breathe. Attempting to open and look in the mouth for an obstruction is not recommended, as the obstruction may be too far back to view and retrieve, and the rescuer could be injured if the patient clamps the teeth together. Rescue breaths are never administered before compressions. Although moving the patient as one unit is important for patients who have experienced trauma, the first step is to assess for circulation. If breathing is still absent, rescue breathing should continue until either respirations are restored, help arrives, or you become too tired to continue. The pulse should be checked periodically. If it is absent, perform 30 compressions per every 2 breaths administered. 49. When checking the sterile supplies in the office, the medical assistant should A. Unwrap and re-sterilize any sterile packs that are older than 21 days. B. Examine sterile packs and discard any that are damaged. C. Arrange sterile packs so that the ones that will expire last are used first. D. Seal sterile packs that are expired in plastic in order to extend the time they may be used. E. Discard sterile packs that have been taken into patient rooms but not used. Correct answer: B. Examine sterile packs and discard any that are damaged. Sterile packs that have been damaged in any way must be discarded or unwrapped and re-sterilized. They can be damaged by water, dropping them onto the floor, or any break in the packaging. Sterile packs are good for 28 days. A. Packs that will expire the earliest should be used first. C. Sterile packs may be sealed in plastic to extend the time that they may be used, but this must be done at the time of sterilization and not when they are due to be re-sterilized. D. The sterile packs are considered sterile until they are opened for use or contaminated in some way. E. 50. Sterile technique must be used when A. Placing sutures in a new laceration. B. Removing sutures from a healed laceration. C. Performing a pap smear. D. Performing a rectal exam in order to do a hemocult. E. Cleaning the skin prior to placement of sutures. Correct answer: placing sutures in a new laceration. Placing sutures is the one procedure listed that must be performed with sterile gloves in a normal situation. All other scenarios necessitate the use of non-sterile exam gloves and are not sterile procedures. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.